Dr. Mariam Ngaeje, a medical doctor by profession and a public health specialist. I'm currently working with the UNFPA Tanzania Country Office as a program specialist in sexual and reproductive health and rights. And I'm also leading adolescent and youth portfolio within UNFPA Tanzania Country Office. Looking at the PAN prevention, the 3.0 document that we've been discussing for the last, let me say, 2 days, and linking with what we are doing as a country in Tanzania, and me as a program specialist also targeting sexual and reproductive health and rights, I believe there's a close linkage with what the document addresses, the streams that the document is trying to address in the next few years, with what Tanzania government is trying to achieve, especially through the Tanzania Development Vision 2050, together with its long-term perspective plans. Why am I saying that? For example, if you look at the streams that have been identified, I look at the service delivery stream, the sustainability stream. Those are the areas that our government is trying to address to make sure that we're improving the quality of services, including HIV services, not leaving behind the condom promotion, comprehensive condom programming, and also other related sexual reproductive health services that we as a country, we are spearheading in maximizing the quality and accessibility of these services. I'll give you a few examples that I believe will the approach that if we continue using the approach that we've been using prior through support from SSLN. The first example that I also gave yesterday was the country ownership and leadership. That is very critical because if you let the country lead from different ministries, department, agencies, for example, in our case, Tanzania Commission for AIDS is leading the HIV prevention component. So if we give ownership to the country to identify critical priorities that the country is aiming to achieve in HIV prevention, if you give them the power to conduct multi-sectoral coordination, identify partners that would wish to work with to ensure that we are diversifying our approaches in curbing new HIV infections, that will be very critical for us to make sure that we are achieving our goals. But also I talked about lessons learning and knowledge sharing. We've been, as Tanzania, we've been attending a lot of SSLN webinars to gather insights from other countries, for us also to share our insights on what we've done in terms of HIV prevention, the data that we've gathered, how we are planning, etc. That component is very important for not only for us as Tanzanians to learn from other countries, but also for us to share experience to other countries on how best we are approaching curbing the new HIV infections in the country, and of course, supporting people living with HIV in Tanzania. But again, there's a component on integration. If we're trying to curb new HIV infections and ending AIDS by 2030, we shouldn't treat HIV as an isolated component. We should integrate it into other components that are related, for example, to health or to governance, so that when you move, we move at once. For example, we can integrate HIV testing services, say into immunization outreaches, or into cervical cancer program, or into family planning program, or strengthen these components into the countries which are not really strengthened yet. I believe we'll have a broader area to curb curb HIV infections and of course AIDS, especially the most vulnerable populations and those who are in the rural areas. For example, if you're going for immunization outreach 30 kilometers from the district hospital, that's a good chance for a woman who is living 30 kilometers from the hospital to access these services. So it will be a crucial component. But again, we've talked about sustainability. Yes, we have resources from bilateral and multilateral partners, but it's crucial and important, as stipulated in the streams, that sustainability and domestic financing is important. So it's important also for us to look into that perspective, that we need countries to sustain HIV response at different levels, not only at the national level, but also at the subnational level. So SSLN, as a condom champion from Tanzania, I benefited a lot from SSLN. For example, I'll just give an example of PSAT tool that we've been using all along to monitor ourselves in terms of HIV prevention in different population characteristics. That was a very crucial step for us and for me, as a medical doctor and as I support Tanzania Commission for AIDS in planning and prioritization. So we've been using PSAT. My first time was in 2002. This is 2026. We've been using PSAT to look at the areas that we've done well, the areas that we still have gaps, and what we can do better. And that one was very critical for us because we don't just do as UNFPA and TACAIDS. First of all, TACAIDS is the one that is coordinating the process of PSAT, Prevention Self-Assessment. In the process of coordinating, we are not only doing UNFPA and TACAIDS. They're inviting multi-sector people from different sectors, from KVP Forum, from ministries, departments, and agencies, from CSOs, and we gather together. That was very, very important for us because we get information and, of course, guidance from different portfolios. You can imagine someone coming from the CSO side. It means they understand what the communities needs. You can imagine someone coming from the UN side. They understand what the global aspects and the need when it comes to HIV prevention. Or someone coming from youth population, a representative from the youth networks. They know and guide us on what exactly we should address when we identify the gaps in the PSAT. Or, for example, someone working with the people in prisons. They also give us an insight on what exactly we should prioritize, especially on the gaps that we've identified in the PSAT tool that we've been working on. So that single experience when it comes to PSAT and how it helps with first of all, strengthening the government capacity, because now they're coordinating, they're evaluating the program, and they're planning. That is very critical for us. The second thing is the multi-sector engagement. UN agencies, CSOs, representation from the youth networks, from the KVP, that was also very important for us to build that multi-sectoral engagement and coordination. And lastly, in the process of evaluating, we were able to identify the gaps, the successes. For example, the first PSAT, we really looked into the condom aspect and realized, you know what? In terms of supply chain, we know that the government and, of course, through other donors, we're procuring condoms. But again, the social behavior change component is missing. What should we do from here? And now we went and sit down and say, probably, in the current political context, we start with the condom promotion through community interventions. So we work together with the government, and now we are trying to approach into that angle to make sure that we're promoting condom use, consistent and correct use of condom through community-level interventions, based on the political context that we are in. Looking at the streams, if I look at the 5 streams, I believe there are 5, and I say that I prioritize one specific stream that I would wish for SSLN to support Tanzania is on the sustainability part. Because with the uncertainties, especially when it comes to resources, financial resources to support community-level HIV prevention, and of course other related care and treatment services, I believe it's very important for SSLN to provide, say, technical support or technical assistance in ensuring that whatever the country is trying to develop or establish when it comes to sustained HIV response is of quality and implementable. And when I say we, I mean the government and development partners with support from UNAIDS and PEPFAR. We were able to develop the National Sustainability Roadmap, which gives us a direction on what we can do as a country to maximize sustainability of HIV response. Having that document is very important, but again, how to implement it, gathering evidence from other countries is very important. Getting technical support from other countries that has already established or SSLN is also very important. That is one thing that relates to sustainability. But also, our government has endorsed AIDS levy. We now have AIDS levy, which is collected from different aspects, from mining to water, even transport. But now the aim is to strengthen the AIDS Trust Fund so that to sustain the national HIV response. That process is already established. But going forward from there, I believe there's a room to get a technical assistance on how best to invest into AIDS levy and prioritize tactic prioritization for these resources that we are accumulating, let me call it accumulating, through AIDS levy. So those are the two areas that I believe would be very important to support, specifically on sustainability from the 5 streams that 3.0 is trying to invest on.